Type 2 Diabetes by Scotty McCoy. Type 2 diabetes is a global health concern. According to Khan in 2017, type 2 diabetes affected about 472 million people worldwide, which is 6.28% of the world's population. Khan also explains that 1 million deaths a year are contributed to type 2 diabetes, making it the ninth leading cause of death. It is also a financial burden on the people who have type 2 diabetes because of treatment costs and other health factors that type 2 diabetes increases the risk of the person developing. As described by Galicia in the International Journal of Molecular Science, regarding the pathophysiology of type 2 diabetes, a malfunctioning of the feedback loops between insulin action and insulin secretion results in abnormally high glucose levels in blood. In the case of beta cell dysfunction, insulin secretion is reduced, limiting the body's capacity to maintain physiological glucose levels. On the other hand, insulin resistance contributes to increased glucose production in the liver and decreased glucose uptake both in the muscle, liver, and adipose tissue. Even if both processes take place early in the pathogenesis and contribute to the development of the disease, beta cell dysfunction is usually more severe than insulin resistance. However, when both beta cell dysfunction and insulin resistance are present, hyperglycemia is amplified, leading to the progression of type 2 diabetes. You can develop type 2 diabetes in many ways. Obesity, diet, genetic disorders, and lack of physical activity all play a role in the development of type 2 diabetes. As explained by Galicia, obesity is the greatest risk factor for developing type 2 diabetes. It can lead to metabolic abnormalities causing insulin resistance. As we just stated, the major contributing factor for developing type 2 diabetes is obesity. Cutting back on carbs, sugars, and fats and increasing exercise can greatly reduce the chances of someone developing type 2 diabetes. Type 2 diabetes can be passed from the parents to children through genetic predispositions for the disease. These genetic predispositions do not guarantee that you will get type 2 diabetes. It just means you are at higher risk. However, you are not going to catch it by contact of any kind with someone who has it. Here are some of the warning signs of type 2 diabetes as listed by Ramachandran: unexplained weight loss, fatigue, irritability, repeated infection, dry mouth, burning, pain, or numbness in feet, itching, reactive hypoglycemia, decreased vision, and impotence or erectile dysfunction. According to SAMI, diabetic patients have an increased risk of developing complications such as stroke, myocardial infarction, and coronary artery disease. However, complications such as retinopathy, nephropathy, and neuropathy can have a distressing impact on patients' quality of life and a significant increase in financial burden. The treatment for type 2 diabetes varies depending on the stage and severity of the disease. It can be controlled by diet and exercise in mild cases. It is called insulin-dependent diabetes, so as the name suggests, it is treated using insulin along with diet and exercise in more severe cases. Now that we have talked about the pathophysiology, development, transmission, symptoms, and treatment of type 2 diabetes, we can all take steps to eat better and move more to help reduce our risk of developing type 2 diabetes.